lot of people just didn't believe it was that serious. I got really sick and it changed my life.
More Americans are testing positive than at any point in the pandemic.
So within a period of a week and a half, we've almost doubled the number of cases.
And there are new warnings about how the virus can spread.
We have been talking about the possibility of airborne transmission and aerosol transmission.
As questions linger around reopening and death rates, what does all of this mean for you? People in Arizona were ready to start their summer. And so was Jimmy Flores. But then he spent a week attached to a breathing tube.
I just felt invincible. I felt like I didn't need to protect myself so much because I was in an environment where others weren't protecting themselves either.
In the last week, Arizona has had more COVID cases per capita than any state or country. While cases did start to fall through May and early June, coronavirus cases have grown by 50% across the U.S., averaging more than 50,000 cases a day. And it's not just because we're testing more. To slow the spread of the virus, experts recommend less than 5% of tests come back positive. But states like Arizona are reporting more than 25%.
We're definitely testing more and finding more cases than before, but the key issue is that the percent positivity of tests is also rising, telling you that the cases are outstripping our increase in testing, meaning that the outbreak is expanding.
In the early days, the pandemic was largely driven by hotspots in the Northeast. But now cases in New York have dropped dramatically and are surging in states like Arizona, Florida, and Texas.
You have to have a plan when you are going to allow the virus to spread. You have to have infrastructure in place for case investigation and contact tracing because you know you're going to get cases. You just have to be able to pounce on them very quickly so they don't spread it to other individuals, especially vulnerable populations. And that's the failure, that's the difference.
For now, the death rate continues to go down nationally, but in southern states, fatalities are on the rise.
It's a false narrative to take comfort in a lower rate of death. There's so many other things that are very dangerous and bad about this virus. Don't get yourself into false complacency.
The last few weeks have been 8 hours of just COVID after COVID after COVID, essentially.
Texas is one of the many southern states that tried to curb the virus while keeping businesses open.
We were one of the first states to reopen the first week of May, and I think that led us down a path that is leading us to be a hotspot now. We never mandated masks before last week as a mandatory order, and so I think that led to a widespread of the infections that we are currently seeing.
Texas has the 10th largest economy in the world, and slowing the spread of COVID-19 meant grinding that economy to a halt.
To some extent, you have to be sympathetic with the people governing because they're trying to choose between two bad things. Do I want to shut down the economy to slow this disease, or do I want to open the economy back up and let this disease run? They've been reactive more than proactive. And if you're watching politicians be reactive, you're watching sort of public opinion live.
We need to really kind of go back to that mentality of we're all one, we're all sacrificing for each other that we had back in March. If we don't take precaution, and if that virus continues to spread into elderly group of population, they're not going to have the ICU space, the resources that they need and deserve when they get sick, and that could lead to catastrophic outcomes. So I truly hope we don't get there by making the right choices right now.
So what does all of this mean for summer?
In the era of this pandemic, there's no activity that's going to be completely safe, but you can think about what activity you want to do and try and make it safer by maybe following public health recommendations.
But those recommendations continue to evolve. This week, the WHO said they are rethinking the way virus particles can spread through the air, and this could affect guidelines for indoor spaces.
Especially in very specific conditions, crowded, closed, poorly ventilated settings.
You're trying kind of what we call a harm reduction approach, where we're just trying to minimize the damage that this virus causes, and there are some simple measures that people can take in order to do that and still be able to enjoy some of the summer activities.
Simply put, don't let your guard down. That means adjusting expectations for the summer.
Definitely not going out and partying and doing all that stuff. You don't even have a desire for doing that. And it sucks because I'm a single guy that is very active, but you have to live with what you have.